understanding your menstrual cycle and fertility anatomy. Imagine your reproductive system as a finely tuned orchestra, with hormones acting as the conductors guiding each part through a synchronized performance. Your menstrual cycle is a complex process that prepares your body for pregnancy each month. It involves two main cycles working together, the ovarian cycle and the uterine cycle. These cycles are regulated by hormones and involve changes in your ovaries and uterus, all aimed at either supporting conception or preparing for a new period. The ovarian cycle starts with the follicular phase, which begins on the first day of your period. During this time, your brain releases follicle-stimulating hormone, which encourages several follicles in your ovaries to grow. Usually, one follicle becomes dominant, producing estrogen that helps rebuild and thicken your uterine lining. As estrogen levels rise, they signal your brain to reduce follicle-stimulating hormone, preventing other follicles from maturing. This phase lasts about 14 days and ends with ovulation, which is the releases of a mature egg from the dominant follicle. Ovulation typically occurs around day 14 of a 28-day cycle. It is triggered by a surge in luteinizing hormone, which causes the follicle to rupture and releases the egg into the fallopian tube. This is your most fertile window, as the egg can be fertilized for about 24 hours after releases. After ovulation, the remaining follicle transforms into a structure called the corpus luteum, which secretes progesterone and some estrogen. These hormones prepare your uterus by making the lining thick and nutrient-rich, ready to support a fertilized egg. If fertilization does not happen, the corpus luteum begins to break down after about 14 days. This causes hormone levels to drop, leading to the shedding of the uterine lining during menstruation. This marks the start of a new cycle. The uterine cycle itself has 3 phases. The menstrual phase is when your uterine lining is shed, resulting in your period. This usually lasts between 3 to 5 days. Following this, the proliferative phase occurs, where rising estrogen from the developing follicles stimulates the rebuilding of the uterine lining. This prepares your uterus for potential pregnancy. After ovulation, the secretory phase begins. Progesterone from the corpus luteum causes the uterine lining to become even thicker and more receptive to an embryo. If fertilization occurs, the embryo will implant into this prepared lining. If not, hormone levels fall, the lining breaks down, and menstruation starts again, restarting the cycle. Hormones like gonadotropin-releasing hormone from your brain, along with follicle-stimulating hormone and luteinizing hormone, coordinate this entire process. Estrogen and progesterone produced by your ovaries provide feedback to regulate hormone production, ensuring each phase happens at the right time. This hormonal balance is essential for fertility and overall reproductive health. Understanding this cycle is especially important if you are managing conditions like endometriosis, where tissue similar to the uterine lining grows outside the uterus. This can cause pain, inflammation, and scarring, which may disrupt your cycle and affect fertility. Treatments often aim to regulate or suppress certain phases of the cycle to reduce symptoms and improve chances of conception. Always consult with a healthcare professional to develop a personalized plan suited to your needs. Tracking your cycle can help you identify your fertile window, which is usually around the middle of your cycle when ovulation occurs. Recognizing symptoms like changes in cervical mucus or basal body temperature can also provide clues about your ovulation timing. If you experience irregular cycles or symptoms of endometriosis, seeking medical advice is important. Your doctor can help you understand your unique cycle and recommend appropriate treatments or lifestyle adjustments. In summary, your menstrual cycle is a beautifully orchestrated process driven by hormones that prepares your body for pregnancy each month. Knowing how your reproductive system works can empower you to make informed decisions about your fertility and health. Remember, every woman's cycle is unique, and consulting healthcare providers is key to understanding and supporting your reproductive journey.